Hello everyone, my name is Shaina. I'm a physical therapist. In today's video, I'll be diving into a very important topic for those who had ACL tear or sprain. ACL is a very important ligament of a knee joint. It is a knee stabilizer and also helps in those tricky rotational movement of the knee. The main reason why people get ACL tear is while doing sudden twisting or turning of the knee, awkward landing while jumping, and a direct hit on the knee while playing any sports. Today I'm going to demonstrate a few exercises which are going to help in reduce swelling as well as strengthen up the muscles which cover your knee joint. So let's get started. Quick but important note, these exercises are only for those people who are non-operative. If you had any surgery or had a repair, then please follow your doctor's and your physical therapist rehabilitation protocol. Now let's dive into the exercises. The first exercise is ankle pump. For this one, you're going to need a towel, roll down the towel and place it under your heel, slightly above your heel. Now from here, you're going to sit straight. You can place your arm behind your back. Now go for ankle dorsiflexion and plantar flexion. So take your ankle up, then take it down. Go for 10 to 20 reps of this exercise. This is going to help stretch your calf muscles and also reduce the swelling around your knee joint. Go for 2 to 3 sets of this exercise and relax. The second exercise is isometric for quadriceps. For this one, you're going to lie down on your back. Now from here, you can bend your one knee and keep your affected knee straight. Now from here, press your knee down. You will feel the contraction in front of your thighs. Hold for at least 5 to 10 seconds and relax. Press again. Go for at least 15 reps into 3 sets of this exercise. Breathe naturally when you're doing this exercise. Make sure you don't hold your breath. And relax. The next exercise is straight leg raise. We are going to work on a hip flexors and quadriceps muscle. So stay in the same position. Now keep your affected leg straight and you can keep your non-affected leg bent or straight, however you're comfortable with. Now from here, press your knee down, engage those quads first, then lift your leg up. Now when you're lifting your leg up, your both thighs should be at the same level. Then slowly take it down. Relax, press again, engage those quads, lift your leg up, toe should point towards you and take it back. Go for at least 10 to 15 reps into 3 sets of this exercise. If you like, you can also do the same exercise on the non-affected side to strengthen up those muscles. And relax. The next exercise is short arc quad set. For this one, you will need a foam roller. I'm using 36-inch foam roller and place it under your knee. If you don't have a foam roller, you can also use the pillow. Just roll it and place it under your knee. Now from here, lie down on your back. Now extend your knee up. Your toe should point towards you. You're working on your quadriceps and bring it back. Take it up. Hold for 5 to 10 seconds and bring it down. Go for at least 10 to 15 reps into 3 sets. And relax. The next exercise is bridges. For this one, you're going to lie down on your back and your heel is going to be hip width apart. From here, lift your hips up, engage those glutes and your core. Hold for 1 to 2 seconds and slowly bring it back. Go for 10 reps into 2 to 3 sets. Breathe naturally. Engage those glutes and relax. The next exercise is seated knee extension. We are again going to work on a quadriceps muscle. So sit straight. You can sit on the sofa or chair, wherever you're comfortable with, or on your bed. Now from here, extend your knee up. Your toe should point towards you. Hold for 1 second and bring it back. Go for at least 15 reps into 3 sets. We are going to work on these muscles. Breathe naturally. If you want to progress, you can hold for at least 5 to 10 seconds. And relax. When you feel comfortable with the previous exercises, then you can progress with these one. The first exercise is heel raises. We're going to work on a calf. So what you're going to do, stand near the chair and your feet is going to be hip width apart. Now from here, lift your heels up and slowly bring it back. Go for 10 to 15 reps into 3 sets. And relax. The next one is standing hamstring curl. So you're going to stand in the same position. Just bend your knee and slowly bring it back. Go for 10 to 15 reps into 3 sets. Breathe naturally and relax. The next exercise is mini squat. For this one, your feet is gonna be shoulder width apart and toes slightly out. Now from here, take your hips back and go for half squat and come back. We're working on a quads. If you feel your pain is aggravating and you're not able to do this, you can skip for now and you can come back whenever you're comfortable. Go for 10 to 15 reps into 3 sets and relax. The next exercises are all advanced exercises. Now when you get comfortable with all the previous exercises I've demonstrated, then progress to these advanced exercises. The next exercise is single leg balance. For this one, you're going to stand straight and your feet is gonna be hip width apart. Now from here, bend your non-affected leg and you're going to balance on your affected leg. Stay in this position for at least 1 minute. If you feel you're not able to balance, you can keep your arms sideways. Breathe naturally. And when you're doing this exercise, look forward. And relax. If you want to make your single leg balance more challenging, then stay in the same position and close your eyes. You will feel it's more tougher. Start with 30 seconds and then you can progress to 1 minute. And relax. The next exercise is lateral walks. We are going to use a TheraBand. I'm using medium resistance TheraBand for demonstration. So take the TheraBand and place it above your knee. Now from here, your feet is going to be shoulder width apart and toes slightly out. Now go for half squat. Now from here, take your one leg out, then bring your other leg in. These are lateral walks. We are working on abductors as well as our glutes. Go for at least 10 to 15 steps each side into 2 to 3 sets. And relax. The last exercise is single leg deadlift. We are going to work on our balance, our hamstring strengthening as well as our glutes. For this one, you're going to stand straight. Your feet is going to be hip width apart. Now in this movement, when your hand is coming down, your opposite leg is going to go back. So the movement is going to look like this. Make sure your back is straight when you're doing this exercise. And relax. So you can start with body weight and then you can progress with weights. So I will demonstrate with the weight. So you're going to hold the weights. Now from here, go for 10 reps into 2 to 3 sets and relax. Additional tips: avoid sudden twisting and turning movement of the knee. Be more mindful when you're doing any activity. Second, focus on your form when you're doing these exercises, then intensity. And third, progress gradually. I hope you feel better with these exercises, and do drop down a comment and let me know about your recovery. And I will see you in the next videos. Thank you.